everyone, I'm Sneha Patil, your host for today. A warm welcome on behalf of Gyanalogy, an IIM alumna-led initiative, to today's Ask Me Anything session with our esteemed panel of doctors, Dr. Prashanth Reddy, Dr. Avinash, and Dr. Prabhu on Corona, the virus that has grappled the world. Let's rewind a bit to 2020 with this short video. Just 1 gram of coronavirus impacting 2 million people in Q3 2020. Due to lack of awareness, the coronavirus cases today have increased to 144 million, including 3 million deaths according to WHO statistics. With 16.6 million cases in India and 21 billion people who have fully vaccinated, there seems to be a light at the end of the tunnel. We can ask our questions to our esteemed panelists today, who will share more about vaccinations and precautions around COVID. It gives me immense pleasure to welcome our panelists for today. Dr. Prashanth Reddy is popularly known as Surgeon of Strategy. He is an alum of IIMB 2017-19 PGP-EM batch. He is heading the Department of ENT at BGES Glen Eagles Global Hospital, Bangalore. He is an endoscopic skull-based surgeon, one of the 50 surgeons in India trained to carry out no-scar brain surgery. He is also the program director for healthcare domain at NSRCEL of IIMB. He is also a consultant for the Healthcare Cluster Development for Bangalore Bio-Innovation Center, BBC, a state-of-the-art incubation center catering to the needs of startup. Our next panelist for today is Dr. Prabhu. Dr. Prabhu is the Managing Director of Hybridnomics Life Sciences and Diagnostics. His lab was one of the first labs in Bangalore to get approval for RT-PCR COVID testing. He has key interests in molecular diagnostics and genetics. He also works with various AI diagnostic tech enthusiasts to build better and faster diagnostics. Our third panelist for today is Dr. Avinash. Dr. Avinash is an onco-radiologist. He works at HCG Hospital, Bangalore. He's working closely with various CT and MRI manufacturers and software developers to make better imaging solutions. This session will be moderated by Rahul Singh, a banker by the day and writer by the night. He is the secretary of IIM Bangalore Alumni Association, Singapore. He serves as the principal of Corporate Advisory Group of IIM Udaipur and is Academic Council Board member of Jaipuria Institute of Management. Rahul is initiator of Gyanalogy, IIM Bangalore alumni-led initiative, which aims to democratize wisdom. He has authored several books on purpose of life, such as You Know the Glory, Not the Story, From Engineering to Ikigai, and An Atheist Gets the Gita. A warm welcome to all our panelists. With this, I would like to hand over to Rahul.
Thank you so much, Sneha. Thank you everybody for joining in, especially to our esteemed panelists. Could I request people who are not speaking at the moment to put themselves on mute? Thank you so much for your cooperation. So I'll go straight into the topic. I know all you doctors are very, very busy. So Dr. Prabhu, the first question is to you, and you are running a diagnostic center in Bangalore. So my question to you is, how do you know that you have corona? कैसे मालूम पड़ेगा आपको कि आपको कोरोना है, और जब पेशेंट आपके पास आता है तो आप क्या टेस्ट करते हैं जिससे ये आप प्रूव करते हैं या ये डिटरमिन हो जाता है कि दिस पर्सन हैज कोरोना और डजंट हैव कोरोना? सो डॉक्टर प्रभु, आपकी क्या राय है इस बारे में?
See, the first question itself is it's boomerang. The question here is that we can't know any flu, it just presents like a flu-like symptom, and it's a simple flu which comes out, and we suspect them to be having corona based on the clinical symptoms. And now the recent what we have noticed from past month is that they don't present like a flu-like point-blank GI symptoms, and with no fever. And some even have presented lately with no fever, no GI symptoms, directly with saturation out. So this particular virus presents with varied clinical presentation. So, and since it was an aerosol contaminant spread out and stuff, now it's no more. It's like an airborne disease. So now there's no point in, frankly speaking, it's gone beyond the control limits. So here, any case which has any symptoms, the first would be suspect would be a corona currently as per now, the strategy, because the amount of cases which are looking at is more than 50-60% current bank rate.
Right. So moving on, Dr. Avinash, what we know is that obviously the polymerase chain reaction is one of the way to ascertain that you have corona. But then there is a lot of talk about CT scan as well. So how does CT scan come into picture, and what can CT scan help us determine?
So basically what we need to know here is CT scan has different users at different stages of the infection. If I look at it in the first phase where we want to diagnose the infection. So as rightly Prabhu said, and everybody knows that RT-PCR is the test which we do for diagnosing COVID. But there are a lot of cases where RT-PCR will show a false negative test because the sensitivity of the test is around 70 to 80%. And with the new strain, we have also been seeing that there are more number of false negatives. So when you have such a scenario where you have a patient where you are suspecting COVID clinically and who needs management, and the RT-PCR is negative, and you want to confirm your diagnosis, yes, in those cases, CT will help to an extent wherever the patient has lung findings. So when we do the CT scan, we are only imaging the lung here, and if the patient has already developed infection of the lungs, we'll be able to see it, and there is a typical pattern which is associated with COVID. And based on that, we can be fairly certain whether the patient has COVID or not. Even in that, we have gradings where we can say the definite whether COVID is definitely there, is it probable, or is it less likely. So that is one thing in the initial setup. So and so once we have diagnosed COVID, the other place where it helps is during the management. So not all the patients require a CT test. Only in those cases who have some moderate symptoms which are not explained can get a CT test to diagnose what is the extent of lung involvement. So whenever we do a CT scan, not only we get to know whether corona is there or not, we can also quantify how much of the lungs are involved. And based on this quantification, we can also determine the prognosis. So many times what will happen is the patient might be asymptomatic, who is resting at home and maintaining the saturation. But when we do a CT test, we'll see that a bit more of the lung is involved than what the patient is feeling Basically, what happens is when the patient is resting, they don't move around and their oxygen saturations tend to be slightly higher, and they do not dip. But the lung changes will tell us in whom we have to be careful and who needs monitoring. And so that is the other thing where we can prognosticate based on the extent of lung involvement, whether the patient will need further management with close monitoring in the ICU or whatever it is. And the third part is looking at how the patient is responding to treatment. Basically looking at if we have two time points and we look at the first and second time point, if the patient is worsening or if there is any change uh, in the sense that when patients recover, we will see that these opacities also tend to resolve. So these are a few of the things where we can CT plays a role in COVID. It is not recommended to be used in every single patient of COVID. As I said, there are specific scenarios where you need to use it in diagnosis, management, as well as in the follow-up.
Right. Thank you so much, Dr. Avinash, for that answer. Dr. Prashanth, moving on to you. Now, when Dr. Prabhu and Dr. Avinash, their team has determined that somebody has corona, you come into picture. You are an ENT surgeon.
Yes.
First point of call, because this is primarily a disease of throat and nose, right? That's where it gets into your body from. So when the patient comes to you, what is the treatment? And a related question to that is, what if the patient cannot come to you? Because now we know that we have shortage of beds in the country, we have shortage of oxygen, we have a lot of things that are in short supply. So what should the patient do when they need hospitalization but cannot come to hospital or cannot be admitted to hospital? B, when they are fortunate enough to be hospitalized, what do you do with the patients?
So first and foremost, whenever someone is diagnosed or is tested positive with a COVID, RT-PCR positive, don't panic. The first and foremost thing which everyone does, not just the patient, but also the people and the family, they panic a lot. And that panic situation is something which we need to address and we need to reduce the panic. First and foremost, don't panic. See how is your oxygen saturation. As Dr. Avinash just mentioned, people sitting alone will sitting idle. Their oxygen requirement is quite low. So we really don't know what is the lung status. A simple test which you can understand how much of a lung involvement is there. In case you can't go and get a X-ray, chest X-ray done or a chest CT done, simple thing is walk around for 6 minutes in your house on a flat surface. So walking around for 6 minutes will ensure that all your muscles will be moving. And because your muscles are moving, the oxygen requirement for the body will definitely increase. And then you will understand whether you really have a moderate kind of a mild to moderate kind of a disease. If it is moderate, when do you say it's a moderate disease? When the oxygen saturation tends to drop more than 5%, or if it drops less than 93, 92, 93, if it drops, then that's when you have to start your you have to go visit your physician. They will assess you, they will advise you if at all you require hospitalization or not. Don't panic and say that there's no bed. Kindly don't do that. The reason behind that is you will not know what exactly is the actual need for the hospitalization. Whether you actually need it or not is something which is determined by the physician. So kindly go visit a physician. If not, you're not able to go visit a physician, contact, use teleconsultation, consult a physician or any doctor online. There's so many teleconsultation apps right now. So utilize that, consult, don't panic. The best treatment for COVID is prevention. Prevention is something which we all have to focus on. That's the only way we can go ahead. The best prevention is wearing proper mask, ensuring that you cover your nose and mouth properly and not wear a mask on your chin or just above your mouth, exposing your nose. It's like wearing your it's like a leaking condom. Literally, it doesn't offer you any kind of a protection. So you need to ensure that you wear a mask properly covering your nose and mouth, because that's the only entry point for corona. No other point. Head to toe PPE doesn't help. People are just wasting PPE kits, wearing head to toe and going out into the supermarkets and other things. That's absolutely waste. You just need to ensure, and especially into the aeroplanes, no need to wear from head to toe PPEs. People need to understand that the COVID infection or the coronavirus infection will occur because of entry through the nose and through the mouth. Another entry point is through the eyes, but that is very, very negligible until unless you're a healthcare worker, wherein you have to cover your eyes with a proper goggle. Nothing else is required. Head to toe PPE is not required. Prevention is the only cure for COVID and to get over this pandemic. And especially in the high rises, especially people who are staying in apartments, they need to ensure that they, if at all there's any COVID case which is positive, floor above, they need to ensure that they are wearing masks even indoor when they're staying inside their house. The reason why I'm suggesting this is because the COVID virus spreads with aerosols. And also, as Dr. Prabhu mentioned, it is almost airborne right now. So prevention in a high-rise apartment or any apartment, multi-level house, you need to ensure that you be masked even indoors. That's the only way you can prevent it. You can see Dr. Prabhu is still wearing a mask because I think he's in his lab nearby. So ensure that you have to wear the mask properly.
Sure. So thank you. So just to summarize, number one, do not panic. Number
Yes.
two, do not wear the mask, but do not overdo it. You do not need a PPE kit. You just need
Exactly.
to prevent yourself. And
Exactly.
prevention is the only cure for this. You cannot be depending on doctors to save you. You need to protect yourself, and that is to be using proper precautions. Even when you are in a high-rise building, even in your house, because it's in aerosols, it's airborne. Wear a proper mask. That is the bottom line message here.
Especially when you step out of your house. When they say outdoor, that means when you're stepping out of your house, especially in the corridors, in the lifts where that is poorly ventilated, please wear mask. Many of them assume that they have to wear the mask only when they step out fully out of the society or their apartment complex. But that's not true. You have to wear a mask, especially when you just step out of your house, because the corridors are not properly ventilated. Unfortunately, the lifts are not ventilated. Ensure that you turn on the fan in the lift and keep it on during this pandemic, because that way there will be proper ventilation. At least some amount of ventilation is occurring in the lift to prevent the aerosol to be concentrated within the steel box.
Sure. Understood. So now we will move on to audience. So if anybody has a question, you can go ahead and unmute yourself and ask your question. So you can ask your question either in Hindi or in English. We have esteemed panelists of 3 doctors here. They will try to answer your question. So if anybody has a question, please go ahead.
If I may ask, I'm Shashwati.
Sure, Saraswati ji, please go ahead.
Yeah. So a lot of messages are saying that taking steam also works as a prevention. I want to know whether that is at all true.
So let me take that question. So definitely steam is helpful for any kind of a virus. So it helps in reducing the nasal congestion. It will help killing or inactivating the virus. It will not destroy the virus, but it will inactivate the virus, and it will ensure.
So I think we lost Dr. Prashanth momentarily there. Dr. Prabhu or Dr. Avinash, would you have any take on that? How effective is steam?
Yeah, so basically now what we have to understand is that whenever we are using steam inhalation, the way it works is that it opens up your nose, nasal blockages or anything, and it improves the circulation there. So whenever we do that, the nasal mucosa and the oropharyngeal mucosa which is there, the health of that is improved. And once that is improved, the chances of you getting an infection is slightly lower. I don't know the evidence for it completely destroying the virus. As Prashanth said, it helps in inactivating the virus. The thing is, whatever we can do, we can try doing it. So if this helps to even a little extent, this can be tried.
Sure. So just
thank you, Avinash, for covering for me. My internet just
may I add a few points here actually?
Sure, Dr. Prabhu, go ahead, please.
Because I had seen a couple of videos of in North India where the stimulation had become very rampant. It's been advised of words saying that stimulation, yes, it's good, but it should have its own limitations. If we increase the amount of steam inhalation, the duration of steam inhalation or temperature of steam inhalation, it is going to be more harmful and it is going to cause more aggressive respiratory disorders. Even if we had a mild infection of COVID, example itself, and if it takes a steam inhalation aggressively, then don't think that it is going to cure your disease, but it's going to progress to ARDS, that's for sure. So the reason for that progression is because what happens is when you aggressively use steam inhalation, it destroys the most important factor, which is your immune system, which is actually protecting it. Your nasal mucosal cilia gets destroyed when you use more of higher temperature steam inhalations. So do not use steam inhalations at a rampant and everyday basis. It has to be used only just to relieve your nasal congestions. That's more than enough.
So Dr. Prashanth, would you want to complete what you were saying?
Yeah, so as Dr. Prabhu mentioned, don't overdo it. Anything if you overdo is a fatality. One thing which can be add on as a supplement to steam inhalation is doing saltwater gargling. That will help decongest the throat and also reduce the cough slightly, not fully though.
Right. So just to summarize, जैसा कि हमारे 3 डॉक्टरों ने बताया कि स्टीम आप ले सकते हैं, लेकिन इसको एक लिमिट में लें, इसको ट्रीटमेंट ना माने, या आपका कंजेशन थोड़ा सा दूर करेगा, लेकिन ये कोई इलाज नहीं है. थोड़े बहुत वायरस आपके जो है इनएक्टिवेट हो जाएंगे, लेकिन पूरी तरह से सारे वायरस नहीं मरेंगे. तो ये आप कर सकते हैं, लेकिन इसको लिमिट में करें. ऐसा ना करें कि इसको हर 6 घंटे पे और आप रोज इसको कर रहे हैं. इसको आप लिमिट में करें. जब आपको कंजेशन फील हो रहा है, तब उस सिचुएशन में आप ये कर सकते हैं. Okay, किसी और के पास कोई और क्वेश्चन है?
Yeah, Rahul, can I ask something to the doctor?
Yeah, please go ahead.
Yeah, good morning, doctor. I have this question. When we talk about CT scan, which is clearly, told that yes, they detect the lung infection. How we will say that, because there are times nowadays, their hospitals are not entertaining you with the CT scan. So D-dimer and IL-6 get the same result as compared to the CT scan. I mean, blood samples are much easy to give, so it's really confusing. Some doctors are telling go for IL-6 or D-dimer. Some are saying go for CT scan.
Question.
Prabhu, you want to go?
Yeah, we both need to answer this question for that. Yeah.
So you can go first. So basically, the thing what we need to know here is that D-dimer tests something else, interleukin-6 tests something else, and the CT scan tests something else. Now, when we do a CT scan of the chest, what we are looking at is what is the condition of the lung. We can see normal lung and we can see abnormal lung. So whenever we have an infection like COVID, what it causes is an inflammatory response within the lung. And whenever such an inflammatory response happens, there are going to be changes where instead of air being within the lung tissue, it is replaced by inflammatory cells, and it can be replaced by fluid. So when we do a CT scan, we see this indirect evidence of COVID, where we can see this infiltrates within the lung. And this is one way of detecting whether you have COVID or not, based on the inflammatory response it can generate within the lung. And when we look at D-dimer and IL-6, D-dimer is a test which is completely different. It will not test your lung capacity. It will not test your inflammatory response. What it tests is what is the chances of you developing a thrombus. So if you have developed a thrombus anywhere in the body, because you need to understand this, COVID is not a disease which is limited to the lung. Okay, it is a systemic disease. So whenever what it can also cause is, it can cause blood thrombosis. So when it causes such a thing, your D-dimer levels will be elevated. If you do a D-dimer, say 100 patients, it's not that all of them will, whoever has tested positive for COVID will show increased D-dimers. It is only in a few select patients who develop secondary complications from developing COVID who will develop a raised D-dimer. And similar to IL-6, IL-6 is a different thing. It is an inflammatory marker. It is completely different from D-dimer or a CT scan. So each of this has its role in certain stages of managing the infection. So that is what I told in the beginning. When we are talking about CT scan, it is not that every patient who tests positive needs a CT scan, or because where the CT scan helps is those in detecting of disease, at least, is those who have tested RT-PCR negative with a high clinical suspicion of COVID. And then when we are looking at the disease per se to see how much the lung damage is there. And D-dimer, coming back to your point about D-dimer, one of the things about D-dimer is it also acts as an indirect marker for thrombosis, as I told. And one of the complications which patients can develop is thrombus. Thrombus is basically a clot within the blood vessel. So when you develop a thrombus like that within the chest walls, the arteries which supply the lung on both the sides, so even that can be imaged with CT scan, where we can do a contrast study and look for evidence of thrombus within the blood vessels which supply the lung. So each of this is different. Each of these has its own value in different stages of COVID infection.
Sure. So does anybody have further
I have a question. This is Lalita here from Bangalore.
Hi, Lalita, please go ahead.
Yeah, good morning. A nice topic, and it's calming to say that, okay, be patient, be calm. That's a nice thing that is going on. One question is, see, there was a friend whose father was detected with COVID, father, mother, and brother. So the father had, I think, little low oxygen, and he was admitted to a very small hospital, I believe, though not in ICU, but he is on oxygen support. But whenever they say detected, I think it was 93, etc. But the hospital staff, apparently because of COVID, no family member is being able to be with the patient. We all know. Now the hospital authorities are calling the patient's family and saying, shift them to ICU, shift them to ICU. This happened whole night again. We were frantically trying to identify something. There is no availability. Morning, she spoke to her dad. It was 95. He told, it seems it was around 6:45, 7 a.m. Around 7:30, 7:45, she gets a call from some attender within the hospital, right? From the hospital authority. Ask your father to be shifted. Now, as a family member, right? Imagine the other side of the story. Then she calls me, Lalita, I need one help. Please help. We are trying to call every number. Some common numbers are so busy and beds are not available. What do you all suggest at this point?
So if I could summarize that question, the question is that you have a patient who has corona. There are no beds available. What do you do?
Yeah. Not only that, see, imagine this one, 95 is the oxygen. I know Dr. Prashanth yesterday in a call, he said, if something is above 92, 93, don't panic immediately, right? And the patient is in the hospital, but the hospital is asking them to go to ICU and all this. What we as parents, the family should decide on these scenarios.
So the reason why they would be suggesting the patient to go to an ICU is you have to understand that the oxygen saturation is at 95 with maybe 12 liters of oxygen. Very high flow oxygen is being given to the patient, and the patient the lungs are deteriorating. So secondary to the deterioration of the lung, the patient cannot be managed in a nursing home with the limited capacity. So in order to help the patient, they are advising the patient to be shifted to the ICU to have a better care. And when in an ICU, usually it is one nurse per patient. So the critical care which a patient gets is much more, vigilant and much more concentrated. That's why they would be advising to shift to the ICU. But unfortunately, with the number of COVID cases, which, as you know, in Bangalore, it is the highest density of COVID, number of COVIDs per district. So Bangalore stands number one. So when we have such a big caseload, the number of beds available is slightly low. Second to which, the availability of bed is something which we are which the government is trying to help, and they have already told that 80% of the beds across all the private hospitals will be opened only for COVID patients. But unfortunately, that is also not sufficient. So that is the catch-22 situation which everyone is right now.
Yeah.
Okay. So there are some questions in the chat. One of the questions that has come is, what is the first symptom to identify coronavirus? So Dr. Prabhu, what is the first symptom? You're on mute, sir.
Okay, so the point here is, as I said, the symptoms is changing a lot. The first initial when it presented was fever and breathlessness and stuff. Now it's been changed. As I said, we noticed a few cases which just presented with diarrhea 1 week back, no fever, and the patient was absolutely normal. Then after a week back, he started developing some kind of congestions in the nose. So therefore, he thought, like, let me get tested. So that was also COVID positive. The second variant of a case which we found is that the patient is absolutely fine, no fever at all, and he directly ends up in ICU with 60-70% saturation. Do a test, it's COVID positive. And fever is now what lately we have observed is fever is no more part of COVID in some variants of it. And when we do a testing of real-time PCR also, what we have found is we test currently around 3 genes or 4 genes in-house, what we are running the test tools. And more than a lack of testing, what we've done, the first variant, what we discovered, the testing which we did was in July. And that time we actually noted saying that we give it as inconclusive. These kind of variants were like, which we couldn't get any genetic data on it because ICMR did not give us any approval. The looking at the pattern of the gene presentations, and when we interlink with that of the clinical presentations, it looks like there are like multiple versions of the disease. So we could go on sub-classifying the symptoms very varied, right from respiratory to that of GI and including cardiac arrest. So that is why, as Avinash was also suggesting, D-dimers is one of the markers we look at. So basically, we are looking at a multi-systemic disorder rather than be specific as a respiratory disease or GI disease. So beware of any symptoms which you get, and keep yourself aware for it that the symptoms are varied. So please consult a doctor, and then he would be the right person to tell you symptoms is normal or quite abnormal.
Sure.
Rather than yourself.
Thank you so much, Dr. Prabhu. Dr. Prashanth, a question for you, because you talked about walking around your house for 6 minutes and seeing how your oxygen saturation level is. Related question coming from Rishi in Singapore. How does pranayam or meditation help? Does it help?
Yes, it does help. It helps clearing up the airways. It helps clearing up the mucosa, and it also improves the immunity. Someone was asking how to improve your immunity. People who are dying because of COVID are usually people who are sedentary. So people who don't exercise, because that will lead to patients having comorbidities. So exercising and staying fit will help people fight corona better.
Right. So we will move on. Does anybody have questions?
Hello. Yeah, I have one question. Can
Yes,
I ask?
please go ahead. Yeah.
Okay. Doctor, good morning. Actually, one of my friend tested positive and his CT value is 29.3.
We can't hear you clearly, Kamlesh.
So
okay.
Yeah, better now.
Better, yeah.
Yeah. So his my friend has got tested positive, got report today, and his CT value is 29.3, and he does not have any issues, but he was having a fever on Tuesday, and then he went for a medication under doctor consultation with some of the antibiotic for last 3 days. Okay. So right now he's okay, But what has happened, his two daughters, they are young kids, actually 6 years and 9.5 years. They started having some fever right now. So what is the guidance? Should we test them daughters today itself or after a few days? He wanted to check on that, doctor.
Prabhu, you want to take that?
Yeah. See, the point here is when he himself is positive and testing the kids is of no thing, we presume that they are also positive. So there's nothing to get it tested up. So if you, the point in Karnataka is that testing is good because we get allocated the number with government, which is useful for bed allocations or admissions. Other than that, I don't find any point in testing it. So testing it just adds up to the panic also, as you said. Yes, you consider them as positive and keep a vigilant, consult a pediatricians and keep a monitor of the kid. The monitoring of the kid will be only two things. One is their intake and their output. So do not make it very cumbersome monitor. Just how much intake they're taking, what's their output, and check their chest movements. Is that really changing the chest movements and stuff? This is fair enough to look at their habits. And output means urine and stool. Input is your water and your food. Are they taking the same? Or is it modified very drastically? Yes, then please take them to the hospital. Do not consult to anybody. Just take them to the hospital. That would be the right version.
So thank you. So Kamesh, I hope that answers. So it's deemed that they are positive and you should take necessary precautions. If you want to test, go ahead. But that is only going to verify what is already kind of assumed. Muruthu has a question there. How is taking steam daily? How will taking steam daily help for both COVID and non-COVID people? I think that has already been answered. So take steam only when you feel congestion. Do not overdo it. So we will move on. If anybody has a question, you can unmute yourself and ask a question.
Hello.
Yeah.
I'm Vishal from Gujarat. I have a couple of questions. One of them was answered that when you are living in a high-rise apartment, what to do. What happens? We are using the same lift the COVID positive patients are using. What are the chances of us getting infected in that lift while wearing a mask? And a question that does fasting reduce your immune system? These are two questions from me.
So when you're using the lift, just ensure that you're wearing the mask properly. And if at all a COVID patient has used the lift, ensure that at least you get that whole lift properly ventilated, because as Dr. Prabhu mentioned, it's no more aerosol borne infection, it's an airborne infection. So ensure that you ventilate the lift properly such that the viral load will reduce. Keep the lift open for few minutes to few hours, and then keep the fan on such that there's proper ventilation, and then definitely you can use the lift. For number two, about fasting and immunity, I think Prabhu is more has a more in-depth knowledge of fasting and immunity. So Prabhu, over to you.
Fasting doesn't alter anything much. So the amount of degree of fasting and what content, the duration of fasting is what matters a lot. And if you're taking a good intake in the morning and fasting for the day, it's not going to hamper anything of your program. In case if you're ill and then you fast, yes, it is going to hamper a lot because you require energy to combat the disease. So you're not supposed to fast.
Thank you. Sashwati, you can go ahead and ask your question.
Yeah, thank you. So I have been using the oximeter for the last 1 year, and generally my oxygen level will be 94, 95, and I have not been having any other COVID symptom, and it is happening for the last 1 year. So what is the prognosis of that, if you can comment on it? Only very rarely I see a 97, 98. Normally it is 94, 95.
Ashwati, you have a different normal. So you may be having an underlying ailment to begin with. Would you want to share that? Is there
yes, I am asthmatic, and I am very much asthmatic. I'm on inhalers most of the times. It's under I manage the asthma. and I have other diseases. I have high pressure, blood pressure, and I'm almost 60, and I have borderline blood sugar. So this 94, 95, when do I need to panic if I get COVID? What will happen to my oxygen level is the question.
So basically, what we need to establish here is already because of the underlying CP, COPD, the increased blood pressure, and other ailments, you are what are considered as a slightly higher risk of developing complications if you develop COVID. So the thing here is, for you per se, the monitoring has to be a bit more vigilant, in the sense that your normal is, as you're saying, it is 94, 95. And as Prashanth had earlier mentioned, that any drop of saturation below 92 or more than 5 from your baseline should be taken as a warning sign and would want you to go get checked for it. So keep a close eye on your saturation, and if it goes below 92 or 90, and in those cases you have to seek medical care because of your already pre-existing ailments.
So Sasha, if I could summarize that, you check your baseline, and 5% below that is when you need to raise alarms.
Right. Thank you. I understand.
Okay, there are some questions in the box, but I would like to,
Mr. Avinash, may I ask?
Puchiye.
Same thing. I'm a COPD patient. So what precautions I have to take to prevent from COVID?
So again, sir, the thing you have to know is the prevention aspect of it does not change whether you have a risk factor or you don't have a risk factor. Of course, in your case, it pays well to be a bit more vigilant in how often you interact with people, how often you go out, and things like that. And if you're going out, wearing your mask, maintaining social distance, these are the only things which are going to help in preventing you from getting an infection. There is nothing else which will say that, okay, for a healthy person, this is the limited amount of precautions, and for an unhealthy person, this is the amount of precautions. I think it has to be made sure that everybody is taking precautions to the utmost extent as they can, because even if you don't have an ailment, you get the COVID, you can pass it on to somebody else. So that would be my advice, is to follow social distancing, put your mask on whenever you're going out, limit your interaction with other people. And if you do this, you should be, you are putting yourself in a better place compared to other behavior.
Okay, thank you.
So one more thing I would like, just in your case, because of your COPD also, so you just need to also monitor how your symptoms have been changing. Like if your respiratory symptoms worsen, if your cough has increased suddenly from what it was from the baseline, or if there is any new change in color in this sputum or anything. So just make sure that you follow this. You know what you have as a baseline, and if there is any change in that deviation, please take please seek medical attention in those cases.
Thank you very much.
So one question we are getting on the chat is about vaccine. So let's first clear some myths about vaccine. Number one, is vaccine safe? Number two, what does vaccine do? If you get vaccine, can you still get the disease? And number three, what are some of the conditions that you have when you should not be getting vaccine? And a question on that is, if you had a mild typhoid last week, can you get a vaccine? So number one, is the vaccine safe?
Yes, it is safe.
Okay. Number two, how effective is the vaccine? If you have gotten vaccine, 1 dose or 2 dosage, how safe are you? Can you get COVID?
So the vaccine is not going to prevent the infection. It will only prevent the complications. So it will prevent, if at all you get the COVID infection, it will not push you towards hospitalization. You will have a mild fever, and with that it should reduce. But that said, a few cases have been reported who require hospitalization, but they have also recovered very, very well if they have taken both the doses of vaccines.
Right.
So
And
yeah,
when can you
one thing
not
I would like,
Yeah, go ahead. Go ahead. Sorry. Go
yeah,
ahead.
one thing I would like to add about vaccination is that people need to understand that even though you take a vaccine, it does not mean you're immune to the disease. It improves lowers the risk of you getting the infection, and it lowers the risk of you getting moderate to severe disease. So it does not mean that once you have done with both doses of your vaccination, you can roam outside without a mask. That is what is the thing. Whenever we are looking at these numbers, saying after one dose you have 80% protection, after second dose you have 94% protection, it only means that you have 94% less chance of getting the infection. It does not mean that you are completely safe from the infection. You can still get the infection, you can still give it to others. So here you have to be socially responsible. The one great advantage of vaccine is the why we need to vaccinate everybody is it is not that you get a vaccine and you get COVID. It's not that it is a disaster. It is going to help because it is going to reduce hospitalizations. And in almost all studies, it has shown that it reduces mortality to nearly 0%. So that is where the utility of vaccine is in preventing moderate to severe disease and in preventing mortality rather than preventing you from getting the infection. So even if you get vaccinated, please take all precautions so that you do not get the infection. If you get the infection, it might be only mild disease, but you carry the risk of transmitting it to others. So even if you get vaccinated, take all precautions and follow all the safety norms.
Sure. One question that we are getting is, when can you not take vaccine? And some people have asked about this fever issue. If you have fever, can you take vaccine? If you have typhoid, or if you had typhoid, can you do it? So what is the opinion on that?
So whenever you had a fever or any inflammatory disorder, kindly ensure that you are fully free of the fever, and also get your C-reactive protein checked before the vaccination, especially if you have any kind of inflammatory disease or fever, because C-reactive protein will give a baseline as to if you are still having some inflammation in the body, because post-vaccination there is a risk of complications if at all you have a high amount of inflammatory reactions or inflammatory mediators in the body. So do ensure that you are fully free of fever. And also, if at all you have any autoimmune disease, do consult with your primary physician before taking the vaccination.
Thank you.
May I add a point here, actually?
Sure, Dr. Prabhu.
As Avinash was suggesting, the vaccines, whatever it's being used currently, they only document saying it's an efficacy of a vaccine. It's not an effectiveness of a vaccine. Please make sure the two terms are two different analogies. Efficacy means the vaccine works good under conditions. What conditions are the subject? This is under research trials. When we classify them as efficacy of 60% or 90%, it's efficacy. It's not effectiveness of a vaccine. Polio is an effectiveness of a vaccine. I suggest polio is like 100% effectiveness. But COVID vaccines is just efficacy of the vaccine, means it does not prove it is effective. So just two terminologies, aware of it and understand. That's the one point I need to add.
Thank you. If anybody has question, please go ahead.
I have a question.
1 second. Can the first dose of the vaccine be Covishield, like if I'm in India, and the second dose be of Covaxin, since both are made using different technology?
Maybe I'll give a layman's answer to it and then I'll pass it to the doctors. There has been some research on this which has said that it might ideally be better for you to get one dosage of one and other for other, so that you are doubly protected. But by and large, the protocol that is being followed is that both vaccines should be from the same manufacturer. Doctors, could you please comment on that?
Prabhu, you want to take that?
Yeah. See, ideally now, currently, to be more educated in vaccinations, what you're taking up. Covaxin, I'm not branding anything of firms now. The vaccinations are produced by different technologies. One called as live attenuated and killed viruses and stuff. These are the one tested and used for centuries. polio, smallpox, all these are tested for centuries and proven to be effective, not efficacy, effective work. But the current other vaccines, which are we call it as GMO vaccines, that is genetically modified organism vaccines, microRNA vaccines, which have been denied ethical approval from past 2 decades. And they have been tested in all possible scenarios. And it was always a pitch. And this scenario, yes, people have come up with a good guidelines, or maybe they had these the new technologies which has come up. So maybe now we are able to produce a good ones. So therefore, we are not sure of the effectiveness of vaccine, but efficacy, yes, it is good efficacy. So we are only left over with whatever we have right now. So it's a choice. And the next point of your question was that should I go for all the types of vaccinations? So it's a choice to you to use a technology which was been tested and driven along, or to use a technology which has been a newer technology, something like if you want to use a pager or you want to use a smartphone. So it's left up to you. So that's a question when we are not sure. So until unless we look at the long-term scenarios.
So should you mix and match vaccines?
Yeah, it's a mix and match vaccine. Frankly speaking, yes.
No. So should you take one Covishield and then should you take one Covaxin? Would you?
The point is that, see, how the immune response is produced by these vaccinations, you need to understand. The GMO vaccine is a vaccine which in turn the culture virus produce an antigenic response using the culture plates. Whereas microRNAs, you create a microRNA to produce an antigen. Live attenuated vaccine, which we already know, tested for a long run, is something like a long run tested thing. And so the principles of each one, though, might end up the same, but the sequelae of these vaccinations are to be tested yet. So that's where it's do or not. The question is as simple like we had a talidazumab drug, which was being prescribed to all the cancer patients. Later on, we discovered that it does produces anencephaly. So these are things like which happens, like hormone replacement therapy was introduced, and later on discovered that it does cause breast cancer. So we stopped. So these are like we were not sure. It comes in a long-term scenarios.
So these are black swan events, and we haven't had the vaccine for so long, only 4 months, right? So we do not have the long. We will. There is no way for us to know the long-term effect of these. But
currently, yes.
I'll just.
But as a protocol, what should you do? You have choice of 2 vaccines. Should you take both the same? In India, at least, should you take both same, or should you take one this and one that? So what is a short answer to that?
I would prefer both same.
Both same.
I'll just add a small point here. That you need to know why we are giving 2 doses of a vaccine, of the same vaccine. If you understand that, it will help you in making your decision. Is that the first dose which we give is always called a primer dose. In the sense, it primes your body to this virus, and then you develop a small immunological reaction, which will not be long lasting. And this will get accentuated when you give the second dose. So your second dose is equally important as the first dose. So if you take the first dose, the effectiveness of vaccine in providing infection will be a short-term this one. Whereas if you take the booster dose, you are giving more ammunition to your immune system to help fight this. So whatever vaccine you are taking, make sure that you take both doses of the same vaccine. If you want to take 2 different vaccines, that is completely fine. You can take one vaccine here, 2 doses. You can go elsewhere and take 2 doses of the same vaccine. But for vaccine to be completely effective, you need to make sure that you take both doses of the same vaccine and not 1 dose of this and 1 dose of other. If you want, like if you take 1 dose of this and the other vaccine is not available, you make sure that at least one of these will get a booster dose.
Right. So the answer to that question is get both the vaccines. Both your vaccines should be same, and that's what I take from there. Any other questions?
Yeah. So good morning. I have a question. So people who are on blood thinners, is it recommended to take vaccines? Because there are articles saying that people with blood thinner, they should not be taking it. So is this something doctor can advise?
Prabhu?
I have blood thinners taking vaccination. I'm no clue on this.
So
I think
I think it's better you can take it because when you're already on a blood thinner, the actual chance of you forming a blood clot is way lesser than a normal person who's not on a blood thinner. But again, you consult your primary physician before you go ahead and take the vaccination, as your primary physician, whoever is treating you, will have the whole case history and he can advise you better than any one of us.
I think here we need to make sure that you need to understand that taking a blood thinner is actually not a contraindication for you to get a vaccine. The only contraindication, real contraindication to get a vaccine is if you have some allergic reaction, anaphylaxis, or anything. Otherwise, no matter what medical condition you have, taking a vaccine, only the other thing is if you're severely immunocompromised. So other than that, and you having allergic reaction, anything else, if you're a cardiac patient, if you're a blood pressure patient, if you're asthmatic, whatever it is, vaccines, there is no general thing to say this is contraindicated in these patients. So even if you're on a blood thinner, I think it is safe for you to take the vaccine.
So Dr. Prashanth, you talked about mask and somebody has come up with this interesting question. Should you wear double mask, one surgical and one of other cloth? It's like a question about, so the question is, should you be using double mask? It's like double condom question.
Exactly. So it's all about wearing it properly. If you don't wear a mask properly, there's no point. Even if you wear a single mask, you wear a double mask, or even if you wear a triple mask, if you don't wear a mask properly, then there's no point.
So one mask is sufficient? If you wear
one multi-layer mask and a surgical mask is sufficient.
Okay. So the answer
for
is
general public. I'm talking about just general public.
One multi-layered mask is sufficient, because what that does is that prevents virus to come in. So one is sufficient.
Properly worn.
Properly worn. If you want to take extra precautions, that's totally up to you, but one is sufficient for all intent and purposes. Okay, any other questions?
Yeah, one question is, if somebody has already taken one dose of vaccine, and after 6 weeks, if he has some mild system of cold and cough, and he want to test and do the testing, and his vaccine is due, should he take the vaccine or he should defer the vaccine?
So Prashant, that's your fever question. So if somebody is under cough and cold after 6 weeks, should they still stick to that 6-week schedule, or should they consider?
They can defer it because first and foremost, the inflammation should reduce in the body, and then they can go ahead and take the dose. And also the recommended interval between the vaccine, especially for Covishield, is 90 days. It's no more 6 weeks.
Okay, so it's 90 days. Okay, right. Yeah, other questions, please?
After the first dose of vaccine, should we get any blood test done? They are saying that you get a blood test done to see, I don't know the exact term here. After the first dose, get a blood test done before the second dose. How is that?
Why would you do that? Why would you do that? That's
I don't know. There is a blood clot tendency.
The system is already so clogged with people who really need that blood test. You should not just go and see, okay, I've gotten a vaccine. Is it working? Let me test it.
No, it's not for that. I'm sorry. It is to test in women. Blood clotting is more. So the theory, I don't know. I'm just asking for the opinion. The theory that says is that after the first dose, before taking the second dose, it is better to check for blood clots and then only go for the CPC or CPR, some test. I'm not sure about the name. So if you can just comment on that, please.
It would not be recommended.
Do you want to take that? Okay, Doctor.
A short answer is it would not be recommended for you to get any other investigation done before getting the second dose of vaccine. because even the risk of thrombosis with the first dose of vaccine is far too low for everybody to be going to the clinic and getting the test done just to see if they can develop that or not.
Right.
So be sure that you will be safe after the vaccine. It has been shown that vaccine has not caused that many adverse reactions. I mean, all of us have been vaccinated in the front line as healthcare workers, and we are doing fine. So you should be fine.
Okay, thank you very much.
Thank
So
you.
in short, we don't require any blood test after vaccination.
Thank
We
you
only
very much.
do it.
Thank you.
We only do it after second dose to verify their responders or non-responders.
Right. Thank you very much.
After 4 weeks, after the second dose.
After second dose, 4 weeks. Okay, thank you very much.
That we do it only in certain clinical scenarios. If you are non-responder, we subclassify that.
But
Right.
Dr. Prabhu, I have a question on that. If you take a vaccine and the next day you see that your body is running temperature, you could be pretty certain that your body has responded to it, right?
No, it doesn't mean that. So that's an inflammatory response which is happening. We test with something called IgG antibodies. The secondary response is good enough. So there are people called as non-responders who do not respond even after second dose of vaccination. So they require multiple doses of vaccination to
So they
produce
would only have an inflammatory
good
response,
amount.
but they would not have an antigen in their body, right? That's what you're saying.
The memory, and we can label them as like memory antibodies. We call them as IgG. So that would not be the sufficient threshold wouldn't have achieved for some people. Some people with the second dose it achieve. Some people require multiple doses to achieve.
Sure. So on that
I mean,
first,
what we need to, just a last point. What we need to identify, I understand there again is that is again a very small subset of patients. So for a general purpose, even after your first dose or second dose, any blood test would not be required. As Prabhu said, only in those cases who are at high risk and you just want to make sure that they are non-responders, you can get it done, but it would not be recommended in all of those people who get either the first or second dose of vaccine.
Sure. Is there anybody who hasn't asked a question yet and has a question?
Yeah, I actually have a follow-up question on that. What are the indicators that our body has not responded to the second dose of vaccine and we need to do a test after the 4 weeks of second dose? And just a second question apart from that is, in times where there is a dire need for plasma donors for saving lives, how can we encourage people to become plasma donors and provide them with the right touch points to donate?
So plasma donation has not been proven to be effective, unfortunately. So this effort, if we can push towards organ donation and blood donation, that would be a much more greater impact than plasma donation. So expand your scope to blood donation and organ donation, that will be more helpful. Plasma donation, unfortunately, has not been effective in the treatment. It's equivalent to remdesivir, unfortunately.
I wanted to bring that point about remdesivir as well. So I've been seeing a lot of panic messages on a lot of WhatsApp group, people asking for remdesivir. What is the opinion on that? What is remdesivir? What does it do? When is it needed, or is it needed?
So remdesivir is an orphan drug which was initially utilized for treatment of Ebola. Ebola disease, as you know, is in Congo. It was in the deep jungles of Congo. Ebola disease was an endemic disease. And remdesivir was the drug which was created to cure or kill the Ebola virus. So they initially thought that that drug can be utilized for curing corona. But with excessive testing, it has been shown that it doesn't help in reducing the mortality. So the panic among the public has to come down. Remdesivir is not useful for helping, or let me put it this way, no one has died if they would have not received remdesivir. So kindly don't get panicked and don't create a big panic situation amongst the doctors or in the pharmacies asking for remdesivir. You have to be strong and you have to be emotionally stable to take care of your patient. That is what is most important right now. Unwanted drugs it's not going to be helpful for anyone.
Right. So, Dr. Prashanth, a question on that is, obviously relatives are not, I mean, there could be a case, but by and large, we are assuming that doctors would be recommending the relatives go get remdesivir, right? So why, when WHO has said, and a lot of other testing has been done, which says that this is not a life-saving drug, it can at most lower the number of days that you stay in the hospital. Why are doctors still recommending this drug?
Well, so remdesivir is definitely helpful in, as you mentioned, reducing the number of days stay in the hospital. So as you know, the shortage of beds is extensive. So for that purpose only, they are asking for remdesivir so that they can free up that patient's bed to be giving it to another patient. Beyond that, it is not going to do anything.
Thank you. Thank you so much for that crisp and very to the point answer. The other question which Sneha had is, how do you know that your body has not reacted? I mean, of course, you could go and do tests, but what are some of the symptoms that would give you initially indicate that your body has not reacted to the vaccine?
Unfortunately, there is no way that we really know until unless we go out and test, or until unless you go expose yourself willingly as a test subject for COVID in front of a COVID patient. So don't just, we have to stay masked and assume that it does not work and stay safe.
Okay,
that's the only way forward.
Yeah, so that's an important point to bring. Even when you have been vaccinated, you may be safe, but you still might be giving the disease to others. Just for your own precaution and for precaution of others, still wear mask even if you have been vaccinated.
Yes.
Okay.
Vaccination with mask is the actual treatment.
So vaccination with mask is the treatment. Vaccination alone, mask alone is not the treatment. That's an important takeaway here. Ashish, you had a question.
Yeah, hi Rahul. Thank you, doctors, for this informative session. I had one question, which was, what if a person has tested positive after first dose of vaccine? When should the second dose of vaccine be taken? Because been hearing multiple views. Somebody says delay it till the inflammation, etc. The period is over. Some doctors have also kind of highlighted there's no need for taking a second vaccine dose then. So what's the right time to be taken a second dose, and what are the other considerations which need to be kept in mind?
Prabhu? Okay, he's not there. So if at all you have been exposed to if at all you have tested positive after the first dose of vaccination, that doesn't mean that you should not take the second dose. You have to take the second dose once your infection has reduced and also at the specified time. So ensure that you, if they have told you after 6 weeks or after 9 weeks, in 90 days, you can take accordingly, but ensure that you don't have a active fever at the time of vaccination. That's all.
Basically, need to do a retest to become negative. Then after negative, maybe 2 weeks down the line, and take a vaccination.
Yeah, we have to know that this is all still new ground for all of us. This is not something we have encountered before, and so when you ask a question like, if I get the COVID infection after my first dose, should I take the second dose? There are people who will speak both for and against it, saying that when you have got a second infection and that will itself act as the booster. And but this is all still new ground for all of us. So we'll see what literature will, I mean, as what data will come up forward and will help us making the decision. But even after getting the COVID infection, there might not be any harm in taking the second dose. But the utility of that, we need to understand, which will unravel itself in the future.
So thank you so much. Our doctors are quite busy fighting on the ground. So I would say that we have another 5 minutes with them. So if you have any questions, you can please ask them now.
Yeah, so I have a question.
Ramesh and Rupam, I would prefer somebody who hasn't yet had a chance to ask.
Sure.
Hello. I have a question. I have also posted it on the chat. So my mother-in-law is about 65 years old, and she's already following. She's taken the first dose of vaccination also, but she's not stepped out of the house or anything, and has been taking all precautions at home. So yesterday she has a slight throat infection. So we are all panicked because we have a kid at home also. So what precautions do we take? I mean, currently she's taking steaming and gargling. So do we also recommend any medicines, or and when do we get her tested, or is it even required? It could be anything else as well, but given the current situation, we're all a little worried.
So steaming and saltwater gargling is good. At the same time, ensure all of you are masked inside your house, because we really don't know if at all it is COVID or not COVID. The
Correct.
only way to understand is to get it tested. So get it tested, and you'll have a better understanding as to whether it's COVID or not.
And how soon we can get her tested? Because, or do we wait for a couple
You
of
can
days?
go ahead and get it tested now. Since she has already developed the symptoms, you can get it tested.
So yeah, this is one thing I would like to add here is that I have been seeing this quite frequently. People who get fever or something, they just say it's just a common cold, it's not COVID. And that is kind of a problem here, because we really actually don't know whether you just have the common cold, whether you have COVID, because the symptoms, initial symptoms at least, are the same for all of these. So if you get any such symptoms of fever, cough or anything, the first thing you need to do is isolate, test, and then go ahead. Please do not think that this is just a common cold. Maybe after 2 days it will settle. I can still go out and see. And only if once I get tested and it comes positive, I will isolate. Don't do that. Isolate yourself as soon as you develop symptoms. Then get tested, and then we can see what needs to be done. And of course, close monitoring at home.
Yeah, she has been currently isolated at home, but we have not gotten her tested because it was yesterday night. So we thought we will get her today, but given the lockdown situation today, so we didn't want to step out anywhere and risk.
You can go for testing. There's no restriction for testing.
Okay,
One thing I will add here is: do you have enough facilities at your home to monitor her, like pulse oximeter and temperature, to just check that at regular intervals?
Yeah, so we have been monitoring using a oximeter. So her oxygen levels are okay, and thermometer also. We have her temperature also recorded. Yeah, today morning at 8 o'clock, she had a little bit, I think 99 she had, but she seems to be fine now. We tested, it was all normal again, but yeah.
Okay, just monitor her symptoms. Irrespective of her symptoms coming down or not, it's better you can get her tested also, just to make sure that the period of isolation which might be required after that can be determined.
Okay, sure. And any medicines do we recommend now to be taken or not? So directly after this?
Yeah, nothing. I mean, there are no, as you know, there are no treatment. You just have to get symptomatic treatment. So if she develops fever, which is troubling her, give her paracetamol. Steam inhalation will help, and this is as much as we can do right now. Just make sure that she's stable, and if she worsens, take her to a hospital and get it tested.
So one question that is on everybody's mind is that what is different this year as compared to last year? So last year we were seeing that this disease was mostly affecting people who are living in congested areas like slums, and we were noticing that older people were getting affected. This year we are seeing that people who are in 20s and 30s are getting more affected, and high-rise buildings are getting affected. So what has changed between last year and this year?
Prabhu, you want to take that?
Point here, what has changed is the variants of the virus has been changed a lot. The first point is that the previous versions of virus were not so contagious, or we call it as infectious. Now the current virus is very infectious, and the symptoms produced by the current virus varies a lot. So therefore, what happens is which symptom, at least the older version of the virus, we knew that these are the symptoms of COVID. And now we have no clue which could be the really COVID ones until unless you get tested. So be, watch for it and then stay safe. That's the only motto we take
And
at this.
why is it like this time we are seeing more cases in high rises and so-called upper middle class and middle class?
The reason I said you that before it was more, now it's an able disease. Now, able disease, like you can't control the air. So that's the first thing we need to look at. So the next point is that the virus is now has ability to spread faster than the last hit when we had it last year. So the faster it spreads, the more people get infected. So the infectivity rate is quite high. So that's the reason why more people are getting admitted. And the exposure means is like the exposure time is very short. Before maybe it had a longer exposure time to get infected. Now the exposure time is short. So that's the reason why even Prashanth keeps saying, wear a mask, proper mask. That's the only way we can save yourself.
Sure, sure. Anybody has questions? We will take like.
So I have a question. Shubham here.
Hi, Shubham.
So I have a question that among the two vaccines which are available for us to get vaccinated, that Covaxin and Covishield, which one is more effective for us to take?
The one
now?
which you can get is more effective.
Take
Which
any
one?
vaccine. Yes, take any vaccine which is available.
Whichever you can get is effective.
Okay,
It does not matter whether you take Covishield or Covaxin. Both of them are effective. Just take whatever is available. Don't wait for one or the other vaccine to arrive.
Thank you, sir.
Yeah, I have a question.
Yeah, please go ahead.
Yeah, before taking the first dose of vaccine, is it necessary for people above 18 years? Is it necessary for them to go for any cardiac test? Because we see few of the cases that people who are getting the first dose of vaccine are getting some issues with like cardiac arrest or something related to that. So is it necessary or is it okay?
I think this needs to be addressed. So I'm not sure. Okay, I think the doctors would like to clear some myth on this.
So the risk of anyone getting any kind of complication is very, very, very minimal. So it's not going to be possible to test everyone, and also after testing look for and see if all there's any kind of a risk factor. There will be some underlying risk factor which can precipitate and they might develop some complication, but we can't directly tie it to the vaccine per se as such. So the short answer is there's nothing, no specific blood test is required. They can just go and get the vaccination done.
Right. So
the people who are suffering from the asthma, okay, and nowadays there is a news that asthma inhalers, okay, the inhaler they which used to, so they are effective on this thing.
So the asthma inhalers are designed to ensure that the inflammation or the bronchioles, which is the tubes within the lungs, that get dilated, and for asthma they can breathe easy. So it is definitely useful for the asthma patients, but it is not effective for killing the coronavirus.
Umar, do you want to ask your question now, or otherwise I'll read it out for the panelist? So anyways, Umar's question is, should ladies avoid taking vaccine during and close to menstrual cycle as their immunity is lower during these times?
Nothing to suggest anything.
Nothing would suggest that.
Yeah.
So no impact, Umar. You can go ahead and
Yeah.
have vaccine anytime.
Yeah.
Okay, so I think we can take one or two more questions and then we'll have to wrap
So
up.
I have a question. I mean, sorry, I asked another question.
Rupam, go ahead.
Yeah. So is there any recommendation for taking the Covishield second dose for senior citizens? Because there are varying reports saying that the larger the gaps are, the efficacy is better. So, I mean, as for the government says, it says 6 to 8 weeks. But one of the doctors said it could be 90 days as well. So is there a recommendation for, especially for senior citizens, for Covishield second dose?
So if you can delay it to 90 days, the efficacy is better. That's what is the study which is being saying. So if you can afford to delay it, you can go ahead and delay it. If at all it is not possible to delay it, you can take it after 6 to 8 weeks.
I'll just add one point here. Please take the vaccine as soon as it is available. So the thing is, even the studies which have shown that, hello. The studies which have shown that the vaccine efficacy improves at 12 weeks compared to 8 weeks, that is a marginal increase. So whenever you get the vaccine, just take it because it will offer you a better protection. So just, I mean, it's a choice, but you can take it whenever you want it after the prescribed time of 6 weeks.
So the short answer is after 6 weeks, anytime you get it, you get it. If you can afford to delay, you can delay, but then you always run the risk that you may not have it when you need it.
Correct. That is what I was trying to.
No, that's what's happening now because the availability is becoming an issue. Yeah, thank you, doctor.
Yeah, that is what I mean.
So I think we can take 2 more questions and we'll have to really wrap.
Yeah. So this is Vinod here. So I have one question here. I see news going on that the nebulizing machine or nebulizers can be used as substitute for oxygen concentrator.
I have seen that video. It is not recommended. It doesn't increase the oxygen concentration. You are just pushing the normal air into the nasal cavity, and the risk of the patient spreading the coronavirus to others is higher. So kindly don't use nebulizer on a COVID patient.
All right. Thank you.
Okay. So
I got a question.
Sure, go ahead.
So first of all, thank you, doctors. So my question, I don't know if you have answered already, is the list of symptoms for COVID seems to be just rising every day. So pretty much everything seems to be somehow related to COVID. So how can one, not trigger the bells of, panic, when there's certain symptoms, and how can they, go test? I know testing is the only way, but wouldn't that create a lot of panic in terms of the test and availabilities? So I just wanted to get your thoughts.
Prabhu, you want to take that? Okay. So if at all there's any kind of a symptom, either it's an abdominal symptom or a chest symptom, ensure that you do stay hydrated, because any viral infection, you need to stay hydrated. Ensure that you are monitoring your vitals properly, and get yourself tested as soon as possible. Don't delay the testing factor as such. After you get tested, consult the physician, whoever is your family physician, take their opinion. And the main takeaway is don't panic. The more you panic, the more worse it's going to get. It's not going to help anyone.
Sure. Thank you, doctor.
Yeah, so the thing we need to kind of understand here is the need for testing. Why we keep saying keep getting tested is because so that we can better manage. One thing we know that almost 90% of the patients, 90 to 95% of the patients come out of it without any problems, and only a very small subset of them go for hospitalization. So even if you get COVID, it does not mean that you are going to need hospitalization or any of that sort. The utility here being that once you know that you have COVID, you are going to isolate yourself and prevent others from coming into contact with you. That is the main reason why we say that go get tested, because once you know that you are tested, at least you can be sure that once isolated, you are not a risk to others in and around you. And when the numbers are shooting up so drastically, it is all our responsibility to make sure that we do whatever we can to prevent the spread of infection. So don't panic even if you get a COVID positive test. Just be calm. Most of them, 95% of them will recover well. Only in a very small subset of patients are there going to be complications. And for that we have, almost everybody will have a pulse oximeter there. So just monitor yourself, see what is going to happen. Once your saturation drops or you develop some severe symptoms, go for hospitalization. Otherwise, do not try, even with mild symptoms, if your saturation is high, maintaining above 94, please don't go for hospitals and ask for admission because you are scared. Don't do that. There is a shortage of beds everywhere. So just, I mean, everybody knows the information is out there for everyone. How you act on it is left to you. So I request everyone to be responsible in this situation, not burden the health system further, and take adequate precautions and measures so that you do not spread it to others as well.
Sure.
Thank you. Yeah.
So we are nearing our end of our time with the panelists.
Last question.
Go ahead. Take that last question.
Yeah. When the person is recovered from the COVID, okay, so how many days he cannot be again infected with this infection?
Immediately also.
Yes.
No, there is nothing to say that once you get an infection after 10 or 20 days or 90 days or 6 months, you will not get the infection. There is nothing to say that you always stand the risk of reinfection. So even if you have got your already tested positive and recovered, even if you have got the vaccine after testing positive, no matter what, you still stand the chance of getting the infection again. So mask, distance, and avoid contact. So these are the things which everybody needs to take care of, irrespective of whether they had COVID earlier, whether they have vaccination, irrespective of all this. This would be the take-home message if I would like to give one.
Right. So we are
in other ways, just stay masked. That's the only way forward. Prevention is better than cure.
I had one question on chat. If I could ask just a very quick one.
Go ahead.
Somebody had a mild typhoid last week, 2 weeks back. It is all recovered. And he was asking me like if he can go for a vaccination.
Kamesh, we have already taken that question, but we will ask our doctors to repeat that.
I'm sorry, then I missed that part, sorry.
So again, I'll just reiterate what was said, that the moment you are free from fever, you can take the vaccine.
Thank you.
Yeah.
Thank you a lot.
So doctors, thank you so much for your time. Sorry, somebody wanted to say something?
Yeah, sorry, just one more question.
Go ahead.
Sorry. Just I wanted to know about RT-PCR. Can we believe on the RT-PCR test, or I have to do the multiple test? Suppose I'm going and I've done the test. So can we believe on report, or I have to do it again to be sure?
Prabhu?
So one thing before doctors comment, I want to make one comment. Please trust your doctors, right? So that's the basic thing you can do. Trust your doctors. They are working in your best interest. Whatever they tell you, just follow. I mean, the problem is that we follow what we believe more in our WhatsApp forwards than what the doctor is saying.
Yeah, that's a good.
No. So RT-PCR, we are not going to doctor, for example.
I know.
A test we are willing to do.
I'm making a side comment that please trust your doctor. If you're going to get an RT-PCR, I'm sure there is a physician looking at it, right? And then the physician will advise it accordingly what needs to be done next. But anyways, let's have a qualified answer from doctors.
See, the question how an RT-PCR is done is what you need to understand that. As of now, the current technology, whatever we are having, that's one of the gold standard technology currently we are having. So though it is a gold standard technology, the advantages is yes, it has more accuracy. It does have some kind of disadvantages too. So the efficacy rate of it's more than 90-95%, I would say, but that 5% of false reactions is acceptable in any kind of testing. So we cannot blame anything and go about it. So your question is, I presume that do you really want an RT-PCR test, or you want to skip an RT-PCR test, something like that. I presume that. As of now, for COVID-19, the only test which really gives you a clue to the answer is RT-PCR. So that's the only one you could say yes to that. And then the next would be rapid antigen testing, which has its own limitation in terms of sensitivity. That is always there.
Sure, doctor. I was just asking because I have been doing testing and every 15-20 days because of so many cases willingly. That's right. Thank you.
I think what you initially said was if you have tested positive, should you trust the report? Was that right? Did I hear it right?
Yeah, that was the question.
Yeah.
Okay.
So that is, I mean, if you have tested positive, you are positive. There is nothing, there are no two ways about it. If you have tested negative, you might still get the infection, but if you have tested positive, please trust the report and take it that you will be positive. So don't question the report once it comes as positive.
See, the question here is like one more thing which I like to highlight. You would have said in the medias and stuff, the black boxes, where people say that I was tested positive. And then I immediately tested in the second lab, it's come negative. There are various reasons for that. One reason, most good, valid reason is that when I do a test on your nose and your throat, I do inflammatory response and I do damage your mucosa. Okay, so when I do another repeat test immediately, so what happens is there is an inflammatory response which has happened, and also my mucosa has been damaged. So they would be in a second test, they would be invariably a blood contamination be there, and the inflammatory responses which you have induced by abrasions of the blood vessels which goes inside your nose would also reduce some kind of viral load at the nasopharyngeal space. So therefore, these are confounding factors when a repeat test is done. When you're positive and you do immediately repeat test, so it does turn out to be negative. So in case if you have a doubt of it, go ahead and do it, but after 3 or 4 days of the first test. If you do it immediately the second day or immediately go down and do it another test, invariably it has more than 50% chances to be false negative. So do not put your dear one.
Right. So thank you so much, doctors, for that. So I'll just hold on to you for one more minute. One takeaway from each of you. Dr. Avinash, you can go first. What is one takeaway that you would like our audience to have?
The one takeaway would be that prevention is better than cure. There is no point of trying to run away, run here, helter skelter. Once you get the infection, looking for beds and everything, then you can prevent getting the infection in the first place. So please, no matter what situation you're in, please follow all precautions which have been advised. Wear your mask, maintain social distancing. And if you do this, you will help in reducing the transmission. As they said, break the chain. Only with that we'll be able to conquer this.
Sure. Dr. Prabhu, are you still?
Yeah, see, the best takeaway is you could look at the model of how different countries have combated it by only two principles: mask and social distancing, which actually we did practice it, and it was very proudful moment when we stood in the queue and practiced the social distancing. Way down from probably November, October, it started disappearing. That is where we made a mistake. So let us not give away the practices of good practices of social distancing.
Right, right. Dr. Reddy, you have the last words on this.
Mask. Wear it properly. That's the only way.
Thank
Cover
you.
your nose, cover your mouth.
Thank you so
That's
much.
the only entry point for your infection.
Yeah. So the bottom line is prevention is better than cure. There is only one way to prevent: mask. Maintain social distancing. If you can get vaccine, please go ahead and get vaccine. Sneha, over to you to conclude the proceeding.
Sure. Thank you, Dr. Prashanth, Dr. Prabhu, and Dr. Avinash for sharing your knowledge on coronavirus and busting some of the myths around vaccination. And a huge salute from all of us to the three of you and all the frontliners out there playing a major part in helping us get over this pandemic. And thank you to the participants for being a great audience and for all the great questions. An ardent request on behalf of Gyanalogy: if you found this session useful, please like and share this video, which is also available on facebook.com/Gyanalogy, with all your family and friends so they can benefit from this knowledge too. Mask up, stay home, and stay safe.
Thank you very
Thank you.
much.
Thank
Great.
you.
Thank
Thanks
you
a
so
lot.
much, doctors. Yeah, bye.
Thanks,
Thank
everybody.
you.
Thank you.
Thank you.